Hi, welcome to Eastern Wellness with Dr. Sufei Kaim. Eastern Wellness with Dr. Kaim is a weekly podcast meant for anyone looking for ways to improve the quality of their life regardless of their current health status. Eastern Wellness with Dr. Kaim covers a variety of different health and wellness topics like nutrition, sleep, exercise, toxins, emotional health, and so much more. Dr. Kaim interviews health experts about tips, techniques, and trends in wellness, as well as regular people who have their own wellness pearls to share. For more health and wellness tips and resources, visit Dr. Sufei Kaim's YouTube channel, and that's Dr. Sufei Kaim, Sufeikime. Thanks for listening.
On today's episode, I sit down and talk with Dr. Jodi Reyerson, and she had been friends for many years. She is a doctor of physical therapies. So, Dr. Reyerson, tell us about yourself and what you do and areas of expertise.
Hi, Sufei. Thanks for having me on today. Sufei, I've been a physical therapist for almost 31 years. I graduated from Des Moines University in 1990, and then also got my my doctorate in 2005 from Des Moines University. In the years that I've been a PT, I've done a lot of continuing education to expand my expertise in dealing with the body systems in a little bit of a non-traditional approach and a very holistic approach. In the recent years, I've done specialized training in the nervous system and stress response, which has been very helpful, especially this past year as we've been dealing with new challenges in our society and for health and wellness.
Okay, so what's your 3 top wellness tips?
Well, wellness is a really important area to consider, and there are so many simple things that we can do to improve our health. The first wellness tip that I like to encourage my patients and my friends to do is to drink more water. I find that most people are very dehydrated, and the body systems just do not respond well to day-to-day life. We don't digest well, we don't sleep as well when we're not drinking water. And ideal hydration is actually a pretty easy formula. If you take your body weight and you divide it in half and you drink that many ounces of water, we're usually pretty well hydrated at that point. Most people initially will end up going to the bathroom a lot. So we need to know that within about 2 weeks, that will shift a little bit and you'll spend a lot more time getting rid of the water. Most of us are on a drought management program with water, so it is important to get hydrated for at least 2 weeks, and then you'll see that change so that you're not up all night. I also recommend to drink water early in the day because that makes quite a difference so we don't have sleep disturbance. My second wellness tip is that we all need to manage our stress levels much better. We tend to run pretty quickly and have stress showing up in our body in different ways. And what I have found recently with people I listen to, I'm hearing that 90 to 95% of all physical issues are actually stress related and emotional issues that are showing up. So this is a very key area that we need to improve on. And then finally, I would encourage everybody to move regularly and often throughout the day so that we can do what our body does best. We were meant to be creatures that move and not be sedentary. And in today's society, that is a problem for many of us, that we are pretty sedentary throughout the day. And in the evening, we sit in addition to what we've done during the day.
So when you say move, what would you recommend the best move, at home?
Well, there are so many things we can do. If you're working from home, I think it's important to get up every hour and march in place or do some reaching and get out of that sitting position. That will really help. There's also, going for a walk out in the sunshine so that you're getting some fresh air. I would walk vigorously enough to get some oxygen flowing, some blood flow, and you get some endorphins. Enjoy nature and, walk with your dog. I have a dog that I love to walk with, and he's always happy, to see me bring his leash out and head out the door with him. So I would encourage people just to reverse positions as regularly as possible, every hour, if that's possible.
That's cool. And could you tell me what is your favorite success story?
Well, Sufei, I've been thinking about this. There have been so many changes that I've seen with people that have been really remarkable. But I think my favorite story was a young lady who had come to visit family. She lives out east, and she had a long history of knee pain. She had had several injuries, and she had had several surgeries as a young person. And she was an avid runner and had to give up her enjoyable activity. That's what she did for fitness and for stress reduction. And she was home visiting, had an appointment with an orthopedic surgeon the week following when she returned home. And in one treatment session, we were able to correct her knee positioning through using manual techniques, which means hands-on work and reintegration of knee function. We also worked on her stress response that was playing a big role in her knee issue. And she walked out of my office able to do stairs pain-free for the first time in several years. And she actually returned to running that weekend, feeling that her knee was stable and safe to run on. And she canceled her appointment with the orthopedic surgeon. This was 5 years ago, and she still has not had knee surgery and is still running on a regular basis.
So is she in her 20s?
Well, she was actually in her mid-30s when I saw her, so she's probably early 40s at this point and is still running for wellness and for enjoyment.
Yeah, that's really young if you need to have knee replacement, you know,
Yeah.
for that age. And so could you tell me, I know you are not doing the normal physical therapy. I think you incorporate a lot of all the brain and autonomic system work. Can you explain to us that what's your technique?
Well, Sufei, as you know, I do some traditional physical therapy because that is what I've been trained in. And so my evaluation initially looks like most PT evaluations where I test range of motion and strength and posture and all of those traditional things. But then I will look at the other systems, some that you've mentioned already, including the nervous system. I look at the lymphatic system. I look at the mobility of the craniosacral system, which is an interesting system of the sutures of the skull and the membranes around the brain and spinal cord. We also look at stress response that is playing such a role for so many people right now. So I mostly address those systems, and then we check to see what the body needs done first. And that is the difference in my treatment than what I used to do when I treated more traditionally. Is I actually check in with the body and figure out what we need to do first and second so that we're treating in the order that the body enjoys or needs. And we see great long-lasting results as well as improved integration in the body system.
Awesome. So what's the best health and wellness advice you ever given?
Well, I think the best advice that I can give to anybody is that they should and can connect with their intuition. And intuition is such a help in our lives, in our physical health as well as our emotional health, that if we can develop good rapport with that part of us that knows what's really going on in our body, we can then develop a relationship that will allow us to trust that intuition so that we know what we need to do and how we need to change our lifestyle so that we can be more healthy and happier in our lives.
So for people doesn't understand what's intuition, can you explain a little bit more?
Yes, this is a big topic of what I should say is popular study. You know, there's so many research projects now being done on intuition, and intuition, in my understanding, is just the ability to know what you don't necessarily consciously know. It's kind of that little urge that you get, or that little, some people will feel it as a voice that they hear that directs them. It's just that knowing that we all have, that God has put in us, that we can trust, because it is what connects our physical and emotional and spiritual parts of us. Intuition is an interesting thing. I have not quite decided where it comes from, except I believe God put it in us.
Okay, awesome. So what is the most common challenge to health and wellness you are seeing in your practice right now?
Well, right now, Sufe, I am seeing so many people that are struggling with increased time on screens, whether it be watching more TV, whether it be on the computer or the telephone. And all of those activities put us in positions that put our head and neck at risk for having pain and dysfunction. We're seeing that these activities also increase our stress response and will affect us in very profound ways in our overall wellness. And so in the last year, we've seen a huge increase in the amount of time that everybody's on the screen, whether you're homeschooling or schooling virtually or doing more homework online, as well as, being on the Facebook and different news feeds to see what's going on in our world.
Yeah. So do you see more people have anxiety, depression, and mental stress during this pandemic?
Yeah, this last year has been amazing for people as far as trying to figure out initially how to distance themselves, how to work from home. We saw a lot of chaos with that, a lot of stress related to that. A lot of people were very afraid of this pandemic that we've experienced this last year. And then also, I think then once we started going back to work and back to school, there was that struggle of how to decide what to go back to, what not to go back to, how to explain maybe what we weren't going back to and why, and feeling the pressure of going back and taking everything back up again. And so there's been just a crazy amount of stress. And, I think that the distancing that has been done has also increased people's stress response. And I'm seeing that with most of my patients, that is one area that we work with probably primarily and first thing for people.
Who is a health and wellness innovator you admire and respect?
Sufe, this was a hard question for me because I have actually learned from so many developers of the techniques that I use. I've just met some of the most amazing people through the years, but my favorite would be John Imes. He is a physical therapist from Southern California, and he is the developer of Primal Reflex Release technique. He has probably researched more than anyone I have ever met, and has actually read all the physiology books and all the neurophysiology books and knows how all of that information actually applies to the way we treat. And he is very aware of the body integration between systems. And because he deals with autonomic nervous system, which is the fight, flight, fright versus the kind of joyful living side of life, he really innovates and draws a lot of things together to heal the body, as well as then applying, traditional physical therapy techniques to what he does and what he teaches.
So do you do a lot of cranial work then?
Yes, I do a lot of cranial work and then implement the primal reflex release techniques. And right now, like I said, in my office, because everyone has had more stress, we're doing a lot of those techniques.
Awesome. So are there any new health and wellness trends you want to try?
I sure do. I am always amazed at the new things I hear about. And recently I have done something that's not so new. I've started intermittent fasting. And I am so excited to see the changes that is already starting to make in my energy and the way I sleep and just the clarity I'm feeling. So I'm pretty excited about that. I'm excited to see how it will turn out over the next few months as I continue with this new technique. And then one other technique that I am in the process of getting set up at my house is a morning kind of ritual or routine of actually getting exposed to sunlight or full spectrum light early in the morning to boost my circadian rhythm and to do some lymphatic circulation activities on the rebounder just to get that lymphatic pump and help with detoxification to then further improve my immune system.
Yeah, I have been doing intermittent fasting for more than 2 years. I feel great. I think
Yes.
that's a really like like for the people who like do try everything and like I lose the last 20 pounds I wanted to lose to get
That's
back to
awesome.
my pregnant weight. So I feel that's awesome. Like, you know, this helped me, fasting helped me to reach my goal. And
Yes.
also like yeah, I feel like the sunlight is so important for everybody. I raise in the farming, you know, I grew up in the farm. So I'm
Mm-hmm.
farmer's daughter, and we usually have the habit of get out with sun and go to bed with sun. So I think that's
Yes,
a really great practice in terms of,
absolutely.
you know, health and wellness stuff. And so, yeah, and so because right now everybody is so stressed with COVID-19, do you have very like easy stuff people can do at home and then can dramatically decrease their stress level?
Sure. There are a lot of things that we can do for stress. And one of the best things that we can do is actually just breathe. You know, there are parts of our brain, Sufei, one in particular called the amygdala, that is kind of a protector, so to speak. And it is a primitive brain structure that doesn't really understand much except for the way we're breathing. It will also, you know, take what we hear, you know, also to help us be aware that we need to look around and things like that. But the amygdala really works well with breath. And when we take a slow, steady breath, and especially focus on exhalation, that helps the amygdala know that we are well, that everything is safe, and that, you know, we're paying attention, that we're kind of present in this perfect moment or whatever. And so the technique that I recommend for most people to do on a regular basis is something that I call 4-7-8 breathing. And it is just as easy as breathing in for a 4-second count, then you hold your breath for 7, and then you breathe out slowly for 8. And the exhalation, again, is what speaks to the amygdala, that tells it that all is well. Because if you think about it, if we startle, what do? We breathe in quickly and we don't exhale. So that is something that the amygdala watches for. And as we're stressed, we tend to breathe a little bit more from our upper chest and forget to take that nice, slow kind of cleansing breath. And so people can do this technique several times a day. We ask that they only do one breath at a time in case they get lightheaded if they exchange too much oxygen. I recommend people will do it sitting down or lying down, probably not driving unless you're sitting at a stoplight or waiting for a train somewhere. At that point, you can certainly take advantage of that few minutes and do some 4-7-8 breathing to calm your body and your mind down.
So for the people never do the breathing technique, can you demonstrate how we do it?
Sure. How about, Sufei, if I have you do it, since I can't count and hold my breath at the same time?
Yeah.
I've always been aware if somebody asks me to hold my breath that they want me to be quiet.
Yeah, okay.
Okay, so we're going to get rid of the air that you have presently in you. So exhale all the way for me. And then I want you to breathe in for a count of 4. Ready? 1, 2, 3, 4. Hold your breath. 2, 3, 4, 5, 6, 7. Exhale. 2, 3, 4, 5, 6, 7, 8. And you can breathe normally. Most people will find that they are more than ready for a breath after they've breathed out for an 8 count.
Yeah, this is amazing. So yeah, I can tell like it feels much better. It have more air in my lung.
Mm-hmm.
So how can listeners connect with you?
Sufei, I'm very easy to find. I'm on Facebook at Jodi Reyerson Physical Therapy. That is my business page, and there's links to my website from there. my website if people want to go directly there to learn more about the techniques that I'm doing. My website is jodiryerson.physicaltherapy.com, and you'll find that there are lots of easy ways to contact me from the website, from Facebook, and just a lot of good information. There's some Facebook posts that I'm doing on stress reduction with lots of good ideas of what to do, as well as movement and screen time activity. So I hope that those areas are helpful for all of our listeners today.
Awesome. So based on our topic today, we will issue a 24 challenge to listener. We can use 4-7-8 breathing technique to decrease your stress. So hope this help everybody to decrease your stress when you are stressed out. Thank you so much for everybody listening, and thank you so much for your time, Dr. Jodi Reyerson. And so we will chat. Thank you.
Thank you. Talk soon.